Tonight's special segment, high-tech healthcare from the comfort of a lounge chair. It's called telemedicine, and it's a new option for patients who would rather stay home than go to the doctor's office. ABC 7's Sylvia Perez shows us exactly how it works.
Let's say you're watching your cholesterol, and even though you're on medication, you wake up feeling a little bit off. Normally, you wouldn't do anything, but maybe you would if you had this.
Just sit and relax, and you're going to feel a little pressure.
And along with that blood pressure reading, how about a quick measure of your balance, your arm strength, even your heart and lung sounds? It's a quick medical check in a lounge chair, and it's for real.
I just was checking.
This is the Health eCare system. Just sit back in the comfort of your home. A healthcare provider who is live on a monitor, for example, through the internet or phone, can check your vitals. High-tech tools and devices added to the furniture make it all possible.
See what's going on. Anytime any new symptoms come up, they can get on the chair and call us.
Add this special mitt called the Physio Glove, and you can get a sophisticated ECG of the heart. Results are transmitted instantly. This checkup is happening at LaGrange Point, an independent senior living community in downtown LaGrange. The facility is a case study site for the system. Resident Eileen Cook has no health issues right now, but she's giving the system a try.
There's a certain amount of confidence in knowing that you have something like this in where you live.
Are you ready to start your session?
Remote monitoring is now seen as an option for bridging the gap between doctor visits. There are now intensive care units where vitals are watched from afar. There are even robots that allow neurologists in one location to check upon patients in another. But telemedicine is not meant to replace the physician. Test results can be interpreted immediately, or they can be stored electronically for the patient's doctors to access later. If trouble is spotted right away, action can then be taken. Advocates say this not only saves time and money, but it can help better manage chronic diseases and could catch early signs of stroke or heart problems. For seniors, it can also act as preventative care that can promote independence.
A doctor could, in the future, prescribe this as for follow-up in someone's home or in an independent community such as this.
The chair and the glove come from an Evanston-based company called Comwell Medical. The creator is cardiologist Daniel David. He started research on remote monitoring of heart patients back in the 70s. A pioneer in telemedicine, he says home monitoring provides a unique picture of overall health that you can't get in a medical facility.
Data collection of what happens at home will be super important to design new ways to treat patients. Telehealth, telecare will be the next step in really taking care of patients.
The real challenge will be integrating telemedicine into the current healthcare system and figuring out who's going to pay for it. But if you want a taste of this practice right now, there are thousands of health-related applications or apps you can access on a smartphone, some costing as little as $1. They do simple things such as tracking your blood pressure to counting calories.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic. But do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room. But that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for the quality care you need, 22 minutes. Average cost to get quality care from a Teladoc doctor, $38 or less. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
Let's ask a simple question. How many hours are there in a week? 168. How many is your doctor's office open? Maybe 40, if you can get an appointment. That leaves 128 hours a week, or 78% of the week, without your doctor. So you probably have a few options. Wait for an appointment. That can take several days or more. And what if you're traveling? You could go to a walk-in clinic and possibly spend hundreds of dollars. Many people go to the emergency room, spending upwards of $1,000 or more, and just for common problems, not even real emergencies. What if there was an affordable, easy solution? Well, now there is the phone. Speak to one of our registered nurses. Tell them about your current health concerns. Then speak with a doctor. Get your questions answered, or even have a prescription called in to your pharmacy. Then save up to 70% on prescriptions. We said it was easy. So take a few minutes and enjoy 24-hour peace of mind. We also have many other affordable health solutions and discounts.